This video is going to go through the single leg bridge test, which is useful when assessing either hamstring or glute endurance in patients following ACL surgery. I tend to use it in and around the 3-month mark myself, and what I'll do in this video is go through how I like to set it up and how I'd approach this test. Essentially what we're doing with any baseline test is we want to be consistent, have a start and end position. So for example, with this test, it's maybe the foot position, maybe putting a marker down where the heel is. What we know with the single leg bridge test is if the foot is flat on the floor and a bit closer to the body, you're probably going to get a little bit more muscle activity around the glute maximus, around the buttock muscles. If we're going to move the foot a bit further away from the body and put our heel into the ground, you're probably going to bias the hamstrings a lot more, and this is the one I tend to use when assessing post-ACL. In terms of start position, we're also thinking are the patient's hands going to be on the floor or the arms going to be crossed? Additionally, as a start position, and with every repetition, we want the patient's bum to touch the floor, and then to rise up fully, extending the hip to 0 degrees, getting the bottom to touch the floor again, and that will constitute 1 repetition. We've also got to think about some failure criteria. So basically, what are we going to deem as a let's stop this test? Is it a 1 strike you're out? Is it 2 strikes? Is it 3? It is really going to be dependent on how stringent you want to be. And also we've got to think about the pace. I would tend to go to 2 seconds up, 2 seconds down with the bridge. I have heard some tests that are work to a metronome of 1 second up, 1 second down. As long as you're consistent, you'll get reliable results regardless of how quickly that you use the test. Essentially, the overriding aim of this test is to perform a limb-to-limb comparison. What can you do on the operated side compared to the non-operated side? You can also look at things such as getting the heel a lot further away from the body. That will make the exercise a little bit harder, get the hamstring in a little bit more of a lengthened state. And sometimes you can use, if available, a higher, more stable surface. This might make the exercise a little bit harder because the patient has to just ascend that little bit higher as they're doing the test.